2 years later, and we've lived here all this while. And when I moved here, I was originally from Iowa, but I lived in Chicago for about 18 years, actually closer to 20 years. When I left Chicago and moved to Rock Falls area, I had a daughter that was living here, and my goal was to come here and die. Seriously. I was going to have a huge surgery that January of 2000. I wanted to be close by so that my daughter didn't have far to go to clean out my stuff, because I had a 30% chance of surviving. I didn't know it then, but I had, what happened to me in 2000 and then the year that I moved here sent me on a trajectory in a totally different direction. I came out of the surgery, but had a serious infection that was related to having had diabetes undiagnosed, and had incurred the infection because I was more susceptible to it, and there were other mitigating circumstances too. But what happened was, it took 9 months for the incision to heal. I began working for Catholic Charities out of Rockford, and working here out of the Sterling office with as a child abuse, child welfare specialist. I specialized in foster care. And I still had an incision that wasn't healed. But, you know, you gotta do what you gotta do. The next year, it was firmly diagnosed that I was a type 2 diabetic, and I began taking treatment for diabetes. In October of 2002, I had to call the CGH ambulance to the house. I was making dinner, and I just had the awfulest feeling come over me. It was a terrible feeling of dread. I'd never experienced anything like it in my life. I said to Francis, I think it's got to get an ambulance here. They took me to the hospital, and then they sent me, I ended up at Trinity West, which is now, I think, Unity. It's one of the Unity Point hospitals over in the Rock Island area. And what they diagnosed me with was blockage in the left anterior descending. There were multiple blockages, not just one. So if anybody knows anything about the left side of the heart, they know that the LED, or left anterior descending, is often called the widowmaker. And if you get a blockage there, you pretty much have a major heart attack, and probably not likely, or less likely maybe in 2000, 2001, 2002 to survive, but I did. And what I didn't have was a heart attack. I just was really in tune to the feelings of my body, and what I had was a blockage, and they repaired it. But less than 6 months later, I'd go back to the hospital, and they had to take me in for a different kind of procedure. That time they were using radiation to be able to freeze or burn open, not freeze, burn open the blocked, or the artery that was occluded, and thinking that that would make it less likely to occlude again or to get blocked again. That held me from April of 2003 until October of 2006. By that time, I'd left working from Catholic Charities and was a substitute teacher for Whiteside County. And I went over to KSB Hospital this time for just a routine visit, and I got hauled into the hospital and found out that I had multiple blockages in the left anterior descending, but other arteries as well, and I needed a quadruple bypass, ASAP. And again, I went back to Unity, or it was Trinity Hospital at the time. A team of doctors from Northwestern came down, and, excuse me, not Northwestern, it was Loyola. And they did the surgery, and that was done in November of 2006. and I was discharged from the hospital around the first week of December, and immediately had the same symptoms as I had before I had the quadruple bypass. And the doctors were telling me, who did the surgery, Jean, you're just suffering from anxiety. You're stressing out about this. You're afraid. Well, it really wasn't just that I was anxious. I really, by February here in CGH's cardio rehab program, I was doing my cardiac rehab, and I collapsed, and they took me to the hospital here, and they said, oh my gosh, you gotta have more surgery. I said, don't take me back to Unity. Send me anywhere else. So they sent me that time to Genesis, and I began in February of 2007 having multiple interventions on my heart between February of 07 and November of 2013. I had 25 stents put in the left side of my heart. There was no room for not one more stent. And there aren't just stents single. There are some that are stents inside of stents inside of stents. So what this causes you to be more anxious, because in some of those years, particularly between February 2000, June 2007, and August of 2012, I would have sometimes 3-4 heart interventions a year. I was just on the edge of my seat all the time. You talk about having your foot on the brake, driving around, proceeding through life, waiting for the shoe to drop. That was me. I was not only getting treatment for my heart, I was on pain medication. I think this is the part that I told a lot to Sherry. Between 2001 and 2012, I was being seen and treated at a pain center in East Moline and was prescribed pain medication, hydrocodone, fentanyl patches that had to be changed every 3 days, and hydromorphone along with cyclobenzaprine or muscle relaxant. Most of the time I spent in my chair sleeping at home. By May of 2012, I had what the doctors thought was a real scare of my heart. And I was being admitted to a hospital, and they said, it's time to change a fentanyl patch. Don't bother to put it on, I told them. Leave it off. They said, we'll keep the company comfortable with morphine. I said, that's fine. But 5 days later, the scare turned out not to be what they thought it was, and I was released from the hospital. Although that August I had a non-stemming heart attack, what was changing was I was waking up. Hey, the pain wasn't getting better. With all pain medication, it was getting worse. And I had to do something about the way I was so scared about the way what's going to happen next, you know? So what they did at the University of Iowa, where I was being treated, is they sent me to a spine center. And at the spine center, they said, you are going to do different. You're not going to be on all these pain medications. I went to the spine center in 2013, and then again in 2014. I had to go off of, well, remember, I dropped the fentanyl patches. And I tell you what, when they discharged me from the hospital in May of 2012, I went through that withdrawal. It was like terrible, terrible, terrible. It was the second time I'd gone through a withdrawal. I had gone through a withdrawal from morphine addiction that I had been addicted to in the hospital when I was 25 having kidney surgery. So I remembered how awful it was to go off of those kinds of drugs, and this wasn't any different. But I got through it with the help of friends and with lots of patience and lots of prayer. It could have been a lot easier, but I did everything I knew how to do then. That's how we all do. We do the best we can. But in 2013, I began doing yoga and learning about meditation because the spine center's clinical psychologist said, I don't care what you know, Jean. You don't know it all. So here's a book that you need to buy, and it was called Mindfulness-Based Stress Reduction, a self-study. It was a workbook, and she wanted me to order it, which I did, and she wanted me to work with it because she said that I needed to have a different relationship with my pain. I needed to have a different relationship with my thoughts, feelings, and emotions and the sensations in my body. Instead of trying to escape from pain, I needed to bring the pain close and bring it close enough to really feel into it and see what it was all about. So I began doing this. As I said, I started the yoga and the meditation in February of 2013, bought the book and started working it in 2014, and by 2015, my priest said to me, "What's different about you? You're here for Mass every Sunday, you're wide awake, you've got a smile on your face, and you look like you're with it." And it was a totally different me. I found myself again. I had been able to go off of the hydromorphone. I was no longer taking cyclobenzaprine, but I did need some muscle relaxant, but they put me on actually a drug that was for persons who have spinal injury. And I was able to reduce the hydrocodone use from 200 tablets a month, and I was taking 7.5 to 10 milligrams of hydrocodone tablets every 6 hours round the clock. I was able to back off of that to where now I take a half a tablet of the lowest dose before bedtime at night, and I use Tylenol during the day. I have a need for back surgery, but because of my heart problem, I can't have it. So I work with a team of doctors at the University of Iowa who give me a minimal amount of pain medicine, and they teach me to feel the pain. And I still have an excellent quality of life, much better quality of life. So now we're going to get started with this presentation. You see, the priest thought I should start teaching this. I said, how about if my background's in social work and I'm an adult educator. Worked for many years for Chicago City colleges, designing English as a second language programs, adult basic education programs. So I said, yeah, I really want to do this. But then I thought, it's been a long time since I practiced social work. I need to go back and get some brush up here on what is this mindfulness and how to really teach it, and maybe I need to be certified in it. So what I did is beginning January of 2016, I began on the teacher training track at the University of Massachusetts, and that's where I began with my training as to become a qualified and certified MBSR teacher. When I came back from that trip in January, that week that I spent away at the working with the teachers from the University of Massachusetts, I came back and started teaching people. There were 24 Catholics from 2 or 3 different churches who came together at Sacred Heart and began meeting me an afternoon and an evening for 8 consecutive weeks to study mindfulness-based stress reduction, and we did the workbook together, the same workbook that I'd use. Okay, now, you know about me a little bit. I want to know about you. So you can answer by raising your hand. How many of you may have felt at some point that your memory was not as good as it needed to be? You can raise your hand. And how many of you may have had to make a decision under some undue amount of stress? Okay? Now, how many of you may have felt some degree of undue anxiety about an event? Okay. Well, listen, the good news is meditation helps with all of that. And I'm really living proof of it. I have to ask you if you're living on autopilot. Sherry was talking about it earlier. This is where you maybe drive to the store, and you get there and you don't remember anything that you might have seen along the way? Or you get here tonight and you wonder if you locked the car. Okay? I keep a record of what medication I take during the day. Sometimes, I was telling this to Sherry last night, I tell you what, Sherry, sometimes I write down that I've taken this medication because I write it down before I take it. Sometimes by the time I get writing it down, I just get up and walk away. I say, wait a minute, did I take that? So then I have to go back and count the pills. So you see, it happens to everybody. How about this? You happen to have, or did I skip one? Yeah, I did. How about this? Anybody ever tell you about storytelling? I mean, I like to read, and I like to tell stories about things that I read, but also I'm well acquainted with this other thing. That's called our storytelling mind. The storytelling mind we've had since we first became aware of others around us when we were small children, watching the people around us, what they were doing. That's how we learn. We model our behavior and the way we react to things by the way we saw our parents react and our caretakers react. So we've had a lifetime of watching how other people do things. We also have a lot of stories that we tell ourselves to help us explain to even ourselves why we do the things we do, why we feel the way we feel, and why other people treat us the way they do. Anybody else do that? So this storytelling is born out of the things we learned, or we thought we were, information we were taking in, but it's also born out of the things we tell ourselves, the things we hear other people say about us. Okay? And this monkey mind, and I ask you, do you have a wandering monkey mind? Because I don't know of anybody that doesn't. The wandering monkey mind doesn't have any direction. It's going everywhere. It goes from one thought to the next. It's ruminating. It's worrying about the future. And it's not always adaptive with regard to our overall happiness. Because there's so many demands on us. There's so many demands for our attention. You see this guy, he's just trying to do everything all at once. And there's a lot of emotional dimensions that are building up in our lives and all the different circles that we're in. So you can think about it yourself. You know, you have kind of pressure cooker building up when somebody maybe asks you to do something. It's maybe now gotten down to a conflict. And the stress of the situation you're faced with builds up in your body, but your attention is outwardly directed, so you're not even aware of what's happening in your body. And then sometimes the pressure builds up to such an extent you're ready to pull your hair out, or sometimes you let go. And you get everybody's attention that way. Because there's this fight, flight, acute stress response triggered, and people then react to you. Oh, you're reacting to yourself, you're feeling very embarrassed, or defensive, and people get scared of your reaction, and sometimes they become defiant. This can be our children, our grandchildren, our coworkers, our friends, the lady at the checkout counter. Over time, this creates a kind of toxic stress. So what's toxic stress? It's the kind of stress that occurs when life's demands consistently outpace your ability to cope. And I want to tell you, at the end of my presentation, I have a paper clip together, stapled together, some of the slides that I thought you'd like to have if you'd like to take them with you. And toxic stress is very challenging to work with because this fight or flight, this wanting to fight or wanting to run away, and sometimes there's also a third element to that, which is going to be really passive, where you just lay down and take a beating. You lay down and let people walk all over you. You don't assert yourself. So this stress response taps into very old survival skills we had back in the ancestors' days, which is just really, believe it or not, built in. It's passed down to us in our DNA, our genetic makeup. So, our ancestors used to worry about being eaten. So they were constantly afraid, right? And also there's this times, it's like, have you ever driven a straight stick? It's a car with a clutch. And have you ever worn that clutch out? I did. Why? Because I want to be sure that I pushed the clutch in when I pushed the brake, really, and what I did is I wore the clutch out. Well, that's kind of what we do with ourselves when we are overwhelmed and we're constantly thinking something's going to happen, something bad's going to happen, so we're ready, we're willing to be prepared, and it's like always being ready to throw our foot on the brake, and we just wear ourselves out. But the solution is one solution: mindfulness meditation. It's a way of relieving stress and having balance in your life. So let's do a very short checking in exercise that will help you to get grounded and have an experience. How many of you have meditated before? Have you prayed? Prayer and meditation, very, very similar. Just both, you be still. So in this short meditation, what I'm going to ask you to do is jump right in and actually do this. You can put both feet on the floor. Uncross your ankles. Keep both your feet on the floor. Push your chair away from the tabletop. And put both of your hands on your thigh. Or maybe you could cup your hands one inside of the other here if that's comfortable. Or if you feel like you need that support, rest them on the table in front of you if that gives you some good, comfortable support. The next thing I want you to do is to close your eyes or lower your gaze, whatever is most comfortable for you. Now I'd like you to bring attention to where your body is making contact with the floor. And notice the solidity of the ground under your feet. I want you now, while you're sitting there propped up by the floor and the seat, to relax your shoulders. Let go. And at the same time, relax your jaw and the tongue. Let it rest in the bottom of your mouth and just be at peace. Maybe you can feel so sensitive to maybe even the touch of the sock against your skin. You can feel your foot against the bottom of your shoe. See if you can feel that. Just allowing the ground to support you. And moving your awareness to your thighs and your buttocks. And noticing where they have contact with the chair. And feeling that. Allowing the chair to hold you and the floor to support you without you needing to do anything. And just feeling that. Breathing into it. And moving your attention to your back. Do you notice where your back is having contact with the back of the chair? Can you feel perhaps the difference where you have contact with the chair and where you don't? What does that feel like? And moving your awareness to your hands and noticing and really feeling into your hands. Where do they feel contact? What are they touching? How do you even know you have hands? And opening your awareness, feeling your entire body sitting here in this moment, on this chair, in this room. And in this last few moments of this short meditation, just being aware of your breath, your breathing, not changing your breath in any way, just noticing it. Noticing where you feel your breath distinctly. Using this as an anchor for you. The chair is an anchor. The floor is an anchor. Your breathing is an anchor. And this is a place that you can come back to over and over again. Whenever your mind wanders off. You just let your breath breathe itself. You don't need to make it any other way than it is. And when you notice that your attention has been distracted from breathing, from the chair, from your feet on the floor, just letting it pass. Come back to the breath. Come back to feeling supported. And when you're ready, you can lift your gaze, open your eyes. In the classes that I teach, I use bells. I forgot to get my bells out of my eyes. I have to ask you, what do you feel? Have you ever done anything like this before? What come up for you?
And we just did this. Feel?
Just a short checking-in exercise. I do this every morning before I get out of bed. So what is this mindfulness? John Kabat-Zinn, who is accredited for this mindfulness revolution we have in this country, and actually it's gone all over the world now, says awareness emerges through paying attention on purpose in the present moment and not judgmentally to the unfolding experience as it unfolds moment by moment. I say it's maintaining moment-to-moment awareness on purpose of your feelings, your thoughts, body sensations, and the surrounding environment using a gentle, nurturing lens. Not judging, accepting. Because you see, when we're mindful, we're creating a space. And even if you feel that you don't have any room to create space in your life to meditate or be mindful, if you could just think about this, that just that moment that you stop, even to think about being mindful or meditating, you created a crack. That space, so ever minute, is a place where happiness and compassion can grow. So you have a triggering event here. And your reaction is going to come later. Or are you going to respond? Viktor Frankl was a medical doctor. He was a Holocaust survivor. He wrote, between the stimulants and the response, there's a space. And in that space is our power to choose our response. And in that response lies our growth and our freedom. That's where we can grow and recognize how free we can be. Because we can choose. Most of us spend each day having silent conversations with ourselves. We talked about that, storytelling. So mindfulness is a kind of listening, and meditation is a kind of mental exercise for the mind, much like physical exercise for the body. We train the mind to focus.
to strengthen awareness, to gain self-control, to respond rather than react, consciously and intentionally, with kindness and compassion towards ourselves first. Before we can give any kindness and compassion to anyone else, we have to fill up ourselves with that. So the practice of mindfulness trains your brain to reclaim a sense of contentment and a sense of meaning in everyday life. To be satisfied with things as they are. Doesn't mean you have to resign yourself to it. It means you say, this is the way things are. What can I learn to do to manage so I can have the best quality of life and reverse that downward spiral of pain and suffering? Not everybody suffers physical pain, but many people do, and many people suffer psychological pain, emotional pain. Now, practicing mindfulness is meditation, and I will use those two words interchangeably. Mindfulness to me means a meditation, and meditation means to me being mindful. A mindfulness-based intervention that I teach teaches you how to relieve stress, identify behaviors that no longer work for you, have a different relationship with your thoughts, feelings, and emotions, a better relationship. So there are two interventions that I'm trained in, but one I'm really qualified to teach, and that is mindfulness-based stress reduction. The other is, and maybe you've heard of it, mindfulness-based cognitive behavioral therapy. So what they've taken is cognitive behavioral therapy, which is a psychological intervention. It is a treatment that you can get from your therapist, your psychologist, your psychiatrist, who provides it, and they couple it with mindfulness. So it's mindfulness-based. I use many of the cognitive behavioral therapy techniques, exercises in my MBSR classes, because there's so much demanding our attention, and it's really difficult to pay attention. And it's really easy to slip when we are confronted by somebody that's upset with us. And then when we react, we get so beat up, we admonish ourselves and beat ourselves up because we judged others. So if John Kabat-Zinn told us that we need to be mindful all moment to moment, we need to be acknowledged, we need to be accepting, we need to be non-judgmental, oh, that's a lot to do. So that's why we break it down, put it into 8 weeks. So that mindfulness tames our wandering monkey mind, calms down the overwhelming thoughts, stops the rumination, helps us to remember, I'm ruminating again. I know that's my pattern. When I'm confronted with not enough sleep, didn't get enough to eat of the right foods today, didn't take my medicine on time, didn't get enough, whatever, I'm more vulnerable to have overwhelming thoughts, rumination, worrying about the future, and when I recognize that's what I'm doing, then I can stop, create a space, and in that space find happiness and freedom. Open my mind and my heart to happiness and joy because of the connection between the mind and the body. There's about 12 inches between the brain and the heart. Some of us more or less. But sometimes it takes almost a lifetime before we understand that connection. That what we think in our mind, we believe in our mind, we feel in our body. So the mindfulness-based stress reduction teaches and reinforces how to develop moment-to-moment awareness of your thoughts, feelings, sensations, and the surrounding environment. That's not so much to think about. I'll show you how we'll do it later. As well as cultivating heartfulness. That intentional nurturing of positive mind states such as kindness and compassion. So let's stand up or shove our chair back and just stretch. And then, if you want to stand up, fine, do that. because the next thing we're going to do is sit down and meditate. So if you want to stand up, put your arms above your head. If you have problems with your rotator cuffs, you might want to just go up so far. Oh, take a nice deep breath, and then as you're dropping your hands, let your breath go. And then when your hands are down at the bottom, turn your palms out, fingers spread apart. If you're sitting, you can do this too. As you lift your arms up over your head, keep these hands out like this. Slightly bend your knees. And as you're lifting your arms up over your head, take a breath. Turn the palms out. Exhale as you release your arms down to your side. Again. And once more. Boy, if that won't clear your mind, I don't know what will. It's a beginner, okay? So in the MBSR classes, we do teach movement. Gentle stretching exercises. Whoops, go back to the meditation, Jean. Okay. So now what we're going to do is another meditation, and this one is going to be a meditation on your breath. But I also want to ask you before we start, is there anyone in this room who has lung disease or a cardiovascular or a pulmonary problem that makes breathing challenging at times?
They don't have to raise their hand, they just
They
need
can
to.
just
Right.
know it to themselves, that's it, they don't have to raise their hand, because there's nothing that you need to do except, instead of doing an awareness of breath, instead of focusing on your breath, although we are all going to bring our awareness to where our breath is coming into our body, those who have an issue with breathing difficulty, they're then going to pick up the sounds in the room. Anybody can do that. And instead of breath, you can pay attention to the sounds in the room. So let's begin. Again, feet on the floor. And I always find if we sit on our sit bones, rather than leaning back on our tailbone, but sitting more upright, we're almost sitting on the bowl of the pelvis rather than the tailbone, okay? And then, drop your shoulders, relax your jaw, hands on your thighs, on the table, cupped in each other, and just bring your awareness to your breath, noticing where the breath is coming into your body. Where do you feel it most distinct? And then, what sounds do you hear? Not that you go out and find the sound, but as you're sitting there quietly, discover what sounds are coming to you. It could be the electrical sounds in the room. It could be the sound of my voice, your own heart beating. And just bringing your awareness to that. Maybe you notice after you've been paying attention to the sounds and aware of your breath, your mind gets distracted and you might get spun out on a thought or a feeling or sensation. And if that happens to you, that's fine. I want you to acknowledge that's what happened and then bring your awareness back to sound. Bring your awareness back to your breath. And as you do that, you're aware that you've been spun out on a thought, on a feeling, maybe even a fantasy, and you become aware that's what's happened, and you bring yourself back, your awareness back to the sounds or the breath. A kind of bicep curl is formed in your brain. Okay? And that's where you're building strength. And you can do this again because you know what? Every time you take a breath, New thoughts, feelings, and emotions come popping through your mind, and it's so easy to get distracted, so it's okay. Just don't get stuck on it. Notice it, let it pass. Label it, let it go. And come back to the sounds, coming back to the breath. And I'm going to be quiet for a moment and allow you to do that on your own. And when you're ready, you can lift your gaze and open your eyes and tell me then, hey, how did you do? Somebody said, I'm tired, I could fall asleep. Temperature's right, quiet, take a little nap here. And if that's what your body needs, then you need to listen to what your body needs. But when we meditate, we're not falling asleep or falling awake. That's the whole name of the game. And meditation is really like anything that unlike anything you've ever done before. Because your mind, although you want to concentrate on the breath or the sounds, your mind carries you away. As soon as you realize that, you bring your mind back to the awareness of the breath or the sounds. And this is what you continually do, and this is what meditation is. It's just that simple. The whole game is trying, failing, starting again, doing, failing, starting again, until it becomes just routine for you to do this. It feels exhilarating when you're done. Okay? Now, moving right along. You can use your brain, you can use your mind in the brain to change the brain. You can use your mind to change the brain, to change the mind for the better, to benefit yourself and others. This is the opportunity we all have. And what research is telling us is this opportunity is self-directed neuroplasticity. How many of you are familiar with the term neuroplasticity? All right. The mind has the ability to change. And I'm not just talking about women changing their mind or men changing their mind. I'm talking about the mind is flexible. Okay? We're all born with between 86 and 100 billion neurons. That's what we're born with, and that's what we'll have until we die. What grows are the connections, the synapses. So when I said you can use your brain to change the way you think by just getting the idea that you're going to do things differently. Create new neural pathways. We know that neurons that fire together wire together. So we can grow and build and cultivate and nourish our inner strengths because they come from our brain structure, and we can change the brain structure when you practice mindfulness. We know that through MRIs we can see the research. I'm just going to slide right through this. I've got these on a flyer for you to take out. When we practice mindfulness, the part of the brain which this functions as self-regulatory processing, our ability to monitor our attention, conflicts, and allow for more cognitive function, this increases. And that amygdala, that part of the brain in the back of the head, that is where the fight or flight center is. It's our seat of our fearful and anxious emotions. They reside there. When we meditate, we're decreasing the size. And this is visibly possible to see on MRIs of persons who have meditated for years, prayed for years, meditated for years, seriously meditating, okay? Just a little bit, like a minute here, 2 minutes there, 5 minutes here, 40 minutes there. So you want big memory? Big brain, use meditation. Dramatically increase the hippocampal cortical thickness, because like an artist molding clay, meditation can shape the learning and memory center of your brain into something beautiful. Allow for less reactivity, strengthen your ability to concentrate, pay attention. So here's an activity. In your folder, you'll find a plain sheet of paper. I want you to pull the plain sheet of paper out. Neuroscience tells us that noticing our drifting attention and being able to return our focus wherever we placed it over and over again is how we create neural pathways, new neural pathways in the brain. So before we do something with the paper, I just want you to close your eyes and imagine that you're sitting or you're laying on the grass. Did you ever do that when you were a kid? I loved that, laying in the pasture and looking up at the sky. Now I want you to get up off the ground and look. This is now your yard, okay? And somebody's walking across your yard and they're creating a path. And they keep taking that shortcut across your yard, and what happens to the grass? The grass dies, and you got this one path, okay? Because that's always somebody doing that thing the same way over and over again, right? So, suppose now that people stop taking that shortcut. What happens to the grass? It grows back. You see, the brain is like that too. If we do things some way, over and over again, we're creating a new pathway. We stop to, maybe we're creating a pathway to be more miserable, creating a pathway to be more angry, more anxious, more reactive. What if we just learn how not to do that? And the grass would start growing again, and that pathway would not be there, or to be shortened, and we just figure not to take it at all. We take the other pathway. So you could take that piece of paper and you can fold it in half, and go ahead and do it right now. Fold it in half again, and keep folding that paper in half until you can't fold it anymore. This is going to illustrate how the neuron pathways are worn into your brain. When you're done, unfold the paper and lay it down on the table. How easy would it be for new information to move along those well-traveled path of neurons you just created? Is it easier for your brain to think of something new or the same thought? The same old ruminations, the same old suffering. So neural pathways are worn into the brain. Can this be harmful, do you think, if the brain gets stuck on a negative pattern, such as anxiety or depression? Can you see how starting something different starts to change that pathway? And that's what we want to do. We want to explore that on our own with a good teacher that can sit down and help you to understand, help you to peel back the layers, say, well, I don't know why people are reacting to me the way they do. And so in the class we talk about that, and we look. Maybe we are going to say, how about if we drop some of those behaviors that aren't working for us so well anymore? Maybe we're not getting the appointments we wanted to get, we're not getting the job we wanted to get, we're not getting the man or the woman we wanted in our life. So we have to start thinking about what we could do different. This neuroplasticity was first long studied when they were working with people who had brain injury. And now we've taken it through and we're looking at what mindfulness can do to change the way we work with people who are victims of post-traumatic stress, people who have head injuries, traumatic head injuries from war. So a simple 4-step mental exercise that you can use to clear your mind. A lot of people use this, and you can use it now. You just can go home with this in your pocket, okay? Stop what you're doing. Take a few breaths. Let's suppose you were ready to walk through the door into another room, or into your home, or into your job, or wherever you are. Just as you get to the door and ready to put your hands on the doorknob, stop. Put your hand on the doorknob and take a few breaths. Observe what's going on around you. What are you thinking? What are you feeling? What are the emotions that are rolling around inside you? And what's going on around you? People, places, smell, taste. Then proceed. This is a technique that's being taught in Madison, Wisconsin to doctors who are preparing to go out in their own practices, because they need to know when they walk from one patient to the next, or one patient's room to the next, that they can let go of what they did for the old patient, the patient they just saw, and be able to clear their mind so they can listen to the new patient. But wouldn't that work well for you and me? For what we're doing, even if we're preparing a meal, taking care of our child, our grandchild. I could think of a million different ways we could apply this in our life.
And is that in the booklet?
You're going to get a picture of how to do this. The same slide. I printed out these slides
Okay, so
on a
it's only
printout
those
for you.
4 steps.
Mhm. So life demands compassion, and you can be more compassionate when you're mindful. So you'll also get something about this, and I know you need time to ask me questions, and I want you to ask some, but here I want to just ask you this. Which of the two wolves inside of you, and believe me, we all have two wolves. One is the angry, reactive wolf, and the other is the kind, patient, loving, compassionate wolf who's going to respond to you. Which one do you want to nourish? This is an old Indian tale. Maybe you're familiar with it. So how do you achieve a steady and consistent reckoning of reality? Take a step back. Become more aware. Accepting. Less judgmental. Less reactive. Do meditation. When you're angry, when you're in a lot of pain, feeling stressed out, need to recover quickly. I have a meditation that I work with when people who have severe pain, and over a period of 7 to 8 minutes, I can take them from having most severe pain, they feel they can't stand it any longer. After we do this meditation, the pain just lets up, sometimes dissipates, and this is a meditation you can learn to do yourself. You don't have to take me everywhere with you. Over time, mindfulness can make the brain and all of us more efficient self-regulators. Wouldn't it be nice if we could regulate our emotions, if we even understood what the full range of our emotions are? Experience the benefit of feeling good and managing effectively, but that's going to require that we experience the negative emotions and we manage them successfully too. So we look very close at those negative things. So here's another technique you can take with you. This is called HEAL. And my friend and teacher, Rick Hansen, who's a what is he? He's done a lot of work in neuroscience. He's a clinical psychologist in California, and he came up with this idea. It's called HEAL. So first, I want you to recall, as you're sitting here, we'll do this together. Have you got a beneficial experience in your memory that you can call up right now? Something that made you feel all warm and fuzzy, really very satisfied, very content. Something very loving, just makes your stomach feel very warm, and you just feel it was the most wonderful experience. And I want you to hold that experience into your mind right now, and now bring it into your body by enriching it and enhancing the experience. I want you to actually breathe. Feel that experience all over again, right now. breathe it in and feel it. What did it feel like? I want to feel that, how wonderful that was over and over and over again. It takes about 15 to 20 seconds for you to enrich and enhance and absorb that beneficial experience into your mind and heart and body. I really want to do that because it's always nice to remember things that make us happy and joyful, but also to link it to something negative that's just a sticking thorn, like a thorn in our side. I have two sons that haven't talked to me for nearly 4 years. Mother Day is approaching. I started thinking about it on New Year's Day. And whenever I think about how I miss them, how I wish they'd call, what happened, what went wrong, that kind of rumination, what do? I recall a beneficial experience of something that I remember about each one of them. It couldn't have, maybe you don't have to bring it about something about that, maybe it's something else. But it's linking a beneficial, positive experience with a negative experience and letting that two thoughts mingle together in your heart. What do you suppose is going to happen to the negative thoughts? They dissipate, they lose their intensity, they lose their control over you. And you can do this all the time. So mindfulness is not meaning that you walk around and meditate once with me and go home and I'm fixed for life. No. You have to keep doing this all the time. So these exercises are simple, right? And you can remember it even if you have to cut that little piece of paper I give you out and stick it in your Bible or by your chair or by your bed and what did she say to do? I'm going to do it again now. And you do it over and over again until it just becomes second nature to you. When bad thoughts come in, when too much pain comes in, I'm going to think about when things were better. And I'm going to let that mingle together inside and let things change, okay? We're taking a positive state and we are installing it as a trait in the mind. That's how you change the brain. That's self-directed neuroplasticity. Benefits our attention, makes us better regulators of our own emotions, makes us adaptable, flexible, accepting, compassionate, calming, resilient, so we can be our best self. Stress doesn't go away, but you experience it as your most clear self. So you're not coping, you're thriving. And the 8-week mindfulness class that I teach, that information is in your folder. The cost of it is in your folder. All people who are in Social Security, SSI, students at the college and the university show me proof of income or their school ID, and they go for a reduced price. Discuss it with me. I also have scholarships, so maybe you'll go through the whole 8-week program and pay $50 or less, what you're able to pay, okay? Because we want everyone to benefit. Have elevated levels of self-compassion. We need it in these days. We need it all the time. Less anxiety, not feeling burnt out when we wake up in the morning. Being more effective, buffered from the stressful experiences that happen around us and be able to stay focused to do what we really want to do. While it's not the answer for all of your problems, it won't buy you a new car or the new house. It's rather that all of life's problems can be seen more clearly through the lens of a clear mind. And that's what's really important. And that's what changed my life. I still have heart failure on the left side of my heart. I'm no longer diabetic. Although if I had a heart event, I might need some insulin in the hospital, but yeah. I still have the same spinal problems. I do stretching exercise. I do yoga. Depends on what kind of day I'm having. I start out early in the morning, set my intention, do a body scan. What kind of a day do I want to have? I check in with how I feel, and I'm good to go. Thank you very much for inviting me here, Sherry. and all of you for coming to listen to what I have to say. I wish for you to create that space. Thank you.